Hi everyone, welcome back to my video podcast. I am recording the same day as the last episode, but I gotta batch content because I don't have a lot of time. So yeah, let's get into it. I wanted to share more about my mastectomy journey post-surgery. I do have vlogs from the days after my surgery. I just haven't gotten a chance to edit it. I feel like I might edit this one faster than that one because there's just so many details in that one, and I look not great because it was right after surgery. Let's see, what day is today? May 16th. So my last surgery was December 19th. So we are 5 months post-surgery, basically. Post my second surgery. So, and I don't know if I shared this, my first surgery was the mastectomy. Double mastectomy, direct to implants, and they put implants in right away the same time. The week after, I went in for a follow-up appointment and my skin was not doing great. It was hidden beneath bandages. So I could see some of my skin. But to me it just looked like bruising. But the surgeon and the nurse, they're like, it looks like your skin is taking a really big hit from the mastectomy and it's so traumatized that your chest is losing blood flow. So essentially I was kind of experiencing necrosis where the skin was dying, and so they said we need to take out the implants. So essentially one of the biggest risks of going direct to implant the same time as a mastectomy was happening to me, and I was really bummed. So yeah, I went into surgery later that day. So I hung around the hospital until they could fit me in that afternoon and got my implants removed and went home the same day. Ever since then, I have been flat-chested, which I didn't expect to be part of my journey, but here it is. 5 months later, I'm still flat. And that's just, how it is. My skin had to heal. It actually took, I want to say 3 full months to heal. The wounds were deep. My skin was so traumatized. And the wounds, yeah, they were open for a really long time. And I get super grossed out and queasy when it comes to any injuries and wound care. Oh my god. So thankfully my husband was here to help me with wound care throughout most of the journey, until I was fine doing it myself, but it was just not fun. It was also really hard for me to look in the mirror. I was just so grossed out and did not like the way that I looked. It was hard the first few months, and also I don't know where I got this idea from. I don't know, maybe I saw people's photos or in movies or whatever, but I just thought when you're flat, your skin is completely flat against the rest of your body. But for me it was not. With mastectomy they really took a lot of breast tissue out, and it's almost like my chest goes inward. It's not a nice smooth flat. It's it dips, and you can kind of see my bone structure underneath, and it just really grosses me out. Even till this day sometimes. I'm still getting used to it, but yeah, so that was hard to accept. But throughout all of this, I think it took me 1 or 2 months after post the second surgery, that I was wait, take a step back. I'm on the other side of breast cancer. I wasn't diagnosed with it. I had the BRCA2 gene, so I'm technically a previvor. But my risk for breast cancer is so much lower because I did the mastectomy, and that's something that it took me a while to remember. That was the whole reason behind everything, and that's the huge plus coming out of all of this, is like, yes, I am dealing with a flat chest and all of the wound care that came with the surgeries, but in the end, I still drastically decreased my risk for breast cancer, and that's something to be so happy and proud of. It took me a while to like remember that point, which is like wild. I was originally thinking of getting implants done like early summer, like in June, but I have some work travel coming up that I do want to do, and maybe it'll be best to do it like towards the holidays again, like when it's more downtime and, you know, it's ideal to stay indoors because it's too cold outside, versus like if I did it in June, then that's like during the nice weather months of the summer. So yeah, I can kind of enjoy the summer weather and everything like that. So it's been okay. I think like it's weird because it feels really numb now. I think that really hit me like 3 months post surgery. Is like it started to, not like painful, but like just a weird like numb pain, but not really a pain. I don't like, it's really uncomfortable at times. Like my surgeon said to like massage it to keep the skin healthy and loose before the next surgery where I get implants put back in. But so yeah, sometimes when I'm like massaging it, it just feels like, I just feel discomfort. Like I'm pretty sure all my nerves are gone. It just all feels kind of numb, basically. So yeah, I don't know. It's like not the same as pain, but it's also not like, I don't know how to describe it. But anyway, my surgeon did say that the next surgery should be fine with my skin fully healed. I do have really thin skin, by the way. Like that's what my surgeon said. I have very thin skin here right now. So she was concerned, and that did concern me, like, will the implants put my skin at risk again? But she said once the skin is healed, like it should be fine. It's just because my skin was so traumatized from the mastectomy itself that putting in implants back then, it was just like too much for my skin to handle. So my skin should be fine the next go around. The thing that we did discuss was like, do I want implants over the muscle or under the muscle? And because of my thin skin, she was suggesting under the muscle. But I'm part of Facebook groups of women who have gone through this, like breast reconstruction after mastectomy, I think is one of the groups. Young previvors is another one of the groups that I'm a part of. So just like looking back to like what people have said and things like that, most people do get their implants over the muscle, and I feel like it causes less issues long term. Like there's always the option to go from over to under if I really want to, but like there are potentially lasting impacts if I go from under to over. Like if you do under the muscle at all, then like I think your muscle is cut or something like that. I don't even remember the details. It's I haven't thought about it in so long, but like it's just, yeah, once it's cut, like it's cut, so you can't really like go back. Versus like if you do over the muscle, there's nothing permanently damaged or permanently done to that area, so you're like, okay. So I am leaning toward doing over the muscle. I just hope my skin is thick enough. It should be fine. I just, you know, maybe the implant might be more visible or whatever if I, you know, when I'm naked, but that's totally fine. I just want the next surgery to go smoothly. So yeah, I'll be hopefully scheduling that for later this year. So I'll be flat for most of this year. I have one wedding to go to, which I think I have a dress for, like a halter dress, which covers like the whole chest area. I've been living in sports bras, which has kind of sucked. None of my previous bra, like I'm definitely not wearing underwire bras at all. but I used to wear knee-high bras, and just the way the fabric falls, and like it's so used to having such a big cup inserted that like it's just like all loose in the front if I wear it. So I've been wearing sports bras because they're like a little bit more flat and more compression in the front, less noticeable under shirts than like, you know, a loose droopy bra with no support in there. So yeah, that's what I've been wearing. And I've had to size up in bras, or like try to wear bras that are bigger, because I don't want the bottom seam to be rubbing too much on my scars, because my scars are under the breast area. So yeah, just those types of things having to deal with, but it's not a big deal. But yeah, that's basically the update for now. I guess 5 months post mastectomy. Let me know if you have any questions, if you're going to go through a mastectomy or going through similar things, DTI, whatever. Happy to help. But hope you enjoyed this video podcast, and I will maybe see you in the next one. Thanks for listening and watching. Bye.